Hi, good. How are you? My name is Stephanie. I'm going to be the nurse with you today. I'm just going to follow up with you after your doctor's appointment.
Hi, I'm Emily. It's really nice to meet you. I just came in for my yearly checkup, and my blood work, I guess, showed that I have hypothyroidism. So the doctor told me a little bit about it. I've been feeling a little more tired than usual, so that's why I came in. But I guess I'm still just confused. He used a lot of big words, and I couldn't really follow along with what he was saying.
Well, I'm sorry that the doctor did not ensure you fully understood your diagnosis. I can clarify it for you in a way that is easier to understand.
That would be awesome.
Okay, so hypothyroidism is a diminished level of thyroid hormone, also referred to as T4. The hormone is created by the thyroid gland.
So where is my thyroid? I know it's like somewhere up here, but...
Well, I can show you. So, this is the thyroid gland. It sits at the front of the throat, just below the Adam's apple, so kind of down here, and it wraps around the sides around the trachea, also known as the windpipe. So I can actually show you on me. So it sits at the front here, and then it can wrap around behind, and it looks almost like a butterfly, as you saw in the picture. Okay, does that make a little bit more sense?
Yeah, absolutely. So did I do something wrong to get this? Like, how did I catch it?
Well, there are several ways that you can develop hypothyroidism, such as disease or destruction of the gland. In your case, this is an autoimmune disease.
That sounds really scary, but it also sounds like I couldn't really have done anything to prevent it.
Sure. I understand that this may be scary for you, but I'm here to support you, and I can also walk you through the treatment plan that the doctor has prescribed, which is taking a medication called levothyroxine. This medication is basically T4, which is the hormone that you are lacking. So by taking this medication, you are replacing the T4 that you are not producing enough of.
Awesome. So I take this like once a week, or when?
So this is actually a lifelong medication, and depending on the dosage, that will determine when you will take it. You will have to discuss that with the doctor, though, as your levels need to be checked periodically, and the dose may need to be adjusted based on the level.
Okay, thank you so much for explaining everything. I feel like I understand it a lot better now.
Of course, I'm glad I could help. If you have any other questions, here's the office phone number. Please don't hesitate to call. I'll see you in 2 weeks for your first lab checkup.
Awesome, thank you. Hi, how are you?
Good, how are you?
Good, I'm Emily. I'm one of the nurses here. I just wanted to review your new medication with you before you left today.
Okay, sure, sounds good.
So I know the other nurses have educated you a little bit about why you're taking this med in the first place. Do you have any questions as to what this medication does?
No, I think I understand. They did a really great job of describing and explaining everything to me.
Okay, so do you mind telling me a little bit about why you're taking levothyroxine then?
Sure, I'm taking levothyroxine because I have hypothyroidism, and I know that there are some side effects like my hair falling out, but I forget all the other ones.
So hair loss is a common temporary side effect that should go away within the first month. Some other common side effects are a fast heart rate, high blood pressure, anxiety, loss of sleep, losing weight, diarrhea, trouble swallowing, and an irregular heartbeat.
Wow, that's a lot.
So you aren't guaranteed to experience any of these, and it's important to know these side effects though, because you need to know that they're from the medication. Some serious side effects are chest pain, heart failure, heart attack, too much T4, and decreased bone density that could possibly lead to bone fracture.
Oh my god, that's really scary.
I see how this can be overwhelming, and I can only imagine how difficult this is for you. However, there's one thing that you can do that's really simple and can assist you in any way, and that is call us. Call the office. We can answer any and all questions that you might have. Here's our number.
Okay, thank you. It's a lot right now, so I thank you for doing this for me.
You're welcome. Any medication, even Tylenol, has a long list of side effects, so just because it's a possibility, it doesn't mean that it's going to happen. So as you know, this is a lifelong medication, and it should take about 1 to 3 weeks to really notice a difference.
Okay. So when do I even take it?
So the best time of the day to take it is in the morning with a glass of water before breakfast. So this will allow the medication to get absorbed better into your system. So today you're being prescribed 150 milligrams of Lavoxyl. If for some reason you want to switch brands, maybe to Synthroid or something, you want to let the doctor know beforehand. But today Dr. Chung is prescribing you 1 tablet of Lavoxyl daily. So can you repeat back to me the medication, the dose, and the time of day that you're going to be taking it?
Sure, I'm taking Lavoxyl, which is 150 milligrams. I'm taking 1 tablet a day in the morning before I eat with water.
Right. Any other questions I can answer for you today?
No, I think I'm good, and I'll see you in 2 weeks for my first blood test.
Okay, awesome.
Hi, I'm Stephanie, and I played the nurse in the first part of the skit. And the techniques that I used to provide patient education was using a visual technique that showed the thyroid gland. And I use that because it helps the patient understand better when there's a picture that they connect to with the words that are being spoken. And it makes it easier for the patient to understand what you're saying, especially if they're a visual learner. And I also offered and showed where the location of the thyroid gland was on myself, so she could identify where her own thyroid gland is on herself and can better wrap her head around her new diagnosis and what's going on with her.
Hi, I'm Emily. I played the nurse in the second part of the project, and I use the teach back method for my educational strategy. I think by asking her to repeat back the dose, the medication, and like when she was going to take it, it shows that she's actually actively listening and she's not just sitting there, and she's verbalizing back to you and to themselves like the information that you were giving. I also brought in the medication bottle just so she kind of had a visualization of what the medication dose was going to look like when she would pick it up in the pharmacy later on.
And that's it.
That's it.